welcome. This is Health Matters with me, Dishen Kumar. Today, we are in IMU Bukit Jalil. Now, what are we doing here? We're here to talk about a certain condition that maybe a lot of you might have, but you don't know about it. Now, if you have pain in your hip or groin area, but the pain is not actually going away, you may have this issue. It's called Femoroacetabular Impingement, or FAI. We're actually here to talk to an expert on the issue and also the types of treatments you may want to go for. One of those treatments is surgery. So if you're interested, join me in this episode. This is Health Matters with me, Dishen Kumar. Okay, thank you, Dr. Gandhi, for joining us today. Now, let's start off with a very direct question. What is FAI?
So FAI is it's an acronym for Femoroacetabular Impingement. Okay, so in basic means it's the overgrowth of bone on the femur, hence femoro, acetabular, which is the socket part of your hip. And when your bone overgrows, it starts hitting on each other, and that's where the impingement comes in. So that's femoroacetabular impingement, overgrowth of bone on both sides of your hip socket.
Now, how serious is this condition? How serious is FAI? And you talked about hip pain. So does everyone who has hip pain has to see a doctor? And how severe is the pain?
All right. Well, if you're talking about how serious, you're talking about prevalence. You know, how common is it in the society? The real answer is we don't know. Studies that haven't been done in Malaysia, definitely, looking at this. But if you were to infer from the overseas literature, how common is it? Well, there's a nice study done in the Netherlands, looking at a population, large population, 35,000 over. It was done about a couple of years ago. Now, they looked at everybody who had hip pain. Now, in those with hip and groin pain, they found that FAI accounted for about 20% of that population. So it is common. There are authors that suggest that the prevalence is anywhere between 15 and 20% of the population, with differing ranges of how severe things are. So now coming back to your question, should everybody see a doctor? Well, if you do have symptoms of pain in the hip or pain in the groin, and it's not going away, then it just makes good common sense. You should see someone. It may be something else rather than just simple muscle pain.
Now, Dr. Gandhi, do all patients who have FAI experience pain? And are there also cases where patients don't really know they have FAI?
Yeah, there is a large number of people with radiological FAI, who actually just go throughout their lives without any symptoms at all. And a lot of times it's an incidental finding. However, those that do have hip pain, it's the reverse actually, those that do have hip pain, and if you do find that clinically they have, or suggestive of FAI, radiologically on the x-rays and MRIs they have FAI, then those is somebody that you actually need to go and investigate further and progress to treatment when required.
So, is pain the main symptom of FAI and things like that? Or is there any other symptoms that come with the pain?
I think the majority of patients with FAI, it's pain. Pain on doing provocative movements or provocative postures, namely in sports, and namely in times when their hips are flexed and when they are in positions of squatting. All right. So those are the most common things. Of course, there are other symptoms as well. You can have not just pain. You can have pain without any provocative movements. You can also get stiffness, reduced range, and those things that affect your functional activity and also your quality of life in the end.
Okay. Why does this happen?
That's a good question. The true answer, again, we don't really know. That A does not always equal to B. We do think that there may be a developmental aspect to this. So there are certain people, as they progress throughout their childhood and as they grow into young adults, have a preponderance to developing this over coverage of the acetabulum and also the femur, hence developing FAI. We do find it more so in patients who are actively involved in sports, and athletes normally are the ones that actually seek treatment, and for the larger population. Does sports cause FAI? Good question. The literature doesn't suggest that, doesn't seem to suggest that. However, there are certain sports that have athletes with more complaints of FAI. For example, like football and there's a study in Korea looking at taekwondo athletes.
Oh, wow.
You know, martial artists that actually have it. You don't expect it much in chess players, you know. So in those situations, so athletes, you know, probably the ones that actually look forward or, you know, seek treatment earlier. But we don't really have a concrete answer to what causes this, who is predisposed to it. We don't know. We do know that FAI seems to affect Caucasians. You know, so the countries in the West, like the US, the Europe, they tend to see much more larger number of FAI compared to, you know, when I was overseas, yes, I definitely saw more FAI cases operated more times than in Malaysia. However, I do think that as the awareness of FAI does increase, then yes, patients who have groin problems, a hip problem, will come forward and we may see our numbers increasing.
And with all the patients you have treated, what is the demographic age? Does it affect more older people or more younger people?
It's normally a condition in the young. You know, FAI, this impingement, you know, some people think is a precursor to developing arthritis in later age. So that's why you see it in the younger adults. Okay, not children, but younger adults after adolescence, you know, normally between their 20s and their 40s. Okay, so that is generally the age. Now, between male and female, practically speaking, in my experience anyway, it's generally more male. However, it's not because it is a true gender preponderance. It's more because, you know, males are more actively involved in athletics and definitely, you know, sports that require more physical contact. You know?
Okay. And now, does this, because you said about the link between arthritis, a precursor to arthritis and things like that, but does this FAI also link, if you have FAI, does it lead you to have also other diseases and things like that?
Well, we do think that FAI does give you a higher risk of developing joint degeneration and hence hip arthritis. Though we don't have the clear answer to this, it does make a lot of biomechanical sense. People with FAI tend to have, you know, problems with their hip. They may lead to changes in their posture to accommodate for the fact that they are symptomatic in their hip, hence developing other problems associated, like, for example, lower back pain. You could even get pain lower down, maybe even in your knees and even the muscles around the area. But to answer your question, is it directly associated with any other problems? We don't know. Hip arthritis, yes, makes a lot of sense, but it could be indirectly relating to other conditions, especially in your lower back and your knees.
Okay, all right. Now, how is FAI diagnosed?
So, it's a diagnosis like almost everything in medicine. You know, we go by a step-by-step approach. So the first thing is taking a good clinical history, you know, asking the patient what symptoms they have, and the next thing is a good clinical examination. So in FAI, if one were to be thinking of FAI, there's certain provocative examinations that you can do. Very importantly would be the Fadir exam, that's flexion, adduction and internal rotation of the hip. So someone who is trained, a trained surgeon, a hip surgeon, or even a physical therapist could go examine a patient and, you know, identify patients with a possible risk of having FAI. So once you have this, then we move forward to radiological investigation, and that seems to be our mainstay at the moment. Traditionally it was X-rays. So X-rays would show this overgrowth of bone on both the femur and the acetabulum. That was traditional. Nowadays, with the advent of MRI, it's much more sensitive. So MRIs, especially MR arthrograms. So this is where we inject a dye into the hip joint. Not only it shows the bone side of things, it actually picks up soft tissue problems associated with FAI earlier. And you get a lot of information from that. And actually, as a surgeon, if I see this, it may direct me towards more aggressive modes of treatment.
But what would you recommend your patients do? Just a normal X-ray first, or then go into the more provocative MRIs? And
I think if you do have a good case, a good clinical history and examination suggestive of FAI, you're young and you're athletic, and this is really bothering you, absolutely. Even if your X-rays are normal, I think in that situation, I would definitely lean towards having more specific or sensitive tests. An MRI arthrogram would be my investigation of choice in someone that I highly suspect of having FAI.